So just to turn my video on to get started, hello everyone, my name is Mary Grace Darmody. I'll just provide some housekeeping notes and introductions and agenda before we turn things over to our panelists who we're very excited to have joining today. So again, my name is Mary Grace. I'm an associate at the Clinton Health Access Initiative. Thank you all for joining the webinar to share results and findings from this year's 2020 Family Planning Report. We're very excited to share the results of the report this morning. The call today is going to run through an agenda. So first off, we will provide some introductory remarks from our speakers. So we'll hear from Chantale Lepine from the Clinton Health Access Initiative, John Skibiak from the Reproductive Health Supplies Coalition, and then Martyn Smith from FP 2020. So big thank you to our speakers and panelists for joining this morning. We're excited to have you. We'll then run through key findings and share some slides that share those findings from this year's report. And hopefully those provide a good recap and a fruitful sounding board for discussion. And then we'll use the remainder of the time to field some questions and answers and hopefully have a rich discussion there. Just some housekeeping notes about the webinar. Please be aware that we are indeed recording and plan to make this recording publicly available after the webinar. The size of the group is notable, so given that we've muted participants on this call, when it comes time to field questions and answers, please feel free to direct questions to the Q&A function on Zoom. And from there, I'll field questions to our panelists or answer them myself. Great, I think with all of that said, we can turn things over to our panelists to kick things off. So Chantale, would you like to get us started?
Sure. Thank you, Mary Grace. I think I speak for John and Martyn and Mary Grace and myself in welcoming everyone to join us this morning or afternoon or evening, depending on your time zone. We're glad you're here. Today we'll be discussing the high-level outputs and insights generated by this year's or the year 2020 exercise around the FP market report. This is our 6th iteration of this particular report. We're very proud of that. And obviously no one is an island, and this report would not exist if it were not for the wonderful collaboration RHSC and ourselves receive each year from all of you. So thank you first and foremost to all of our partners, without which, again, this would not happen every year. Specifically, we want to thank our friends in the industry, manufacturers and suppliers that so graciously share rich data with us. And we now have 16 participants in the report, as opposed to 15 last year and the year before. So we welcome our new manufacturers participant and Medicines 360, welcome. And we'll also like to thank, obviously, our donor community and all the stakeholders that have provided such invaluable insight to this report. Lastly, thank you to RHSC, John and your team for the continued partnership with us on this report. Thank you very much for that. Just a note, this report is a tool amongst other tools. It is available, readily available to the community to inform decisions. It leverages supplier shipment and provides a view into public sector procurement of contraceptives in the FP 2020 markets. It complements other family planning related analyses that may focus more on demographic data or consumption data. So it is indeed a tool. It has a very specific scope that Mary Grace will be underlining in her presentation, but it's a wonderful tool that obviously complements a number of other tools within our space so that we together can make better decisions. So without any further ado, I'll ask John now to say a few words. Thank you, John.
Great. Thank you, Marie Chantale. Yeah, I mean, I too would like to join you in thanking everyone, on behalf of the RHSC for joining us this morning to share and discuss the results of the 2020 CHAI RHSC market report. I think one of the things that you pointed out, but I think that's kind of struck me within the context of the kind of COVID environment of home confinement, is how time flies. The week begins, and before you know it, it's over. In my case, there's probably old age that has something to do with it as well. But I was amazed when I was reading in an early draft of this to see that we're already on the 6th iteration of this report, the first one having come out in 2015. But I think as quickly as the last 6 years have flown by, I think the fact is that this collaborative community effort has really opened our eyes to trends and patterns that are also becoming more and more apparent in other assessments of the broader reproductive health space. And we're seeing in this report, as in so many others, declines in overall public sector investment, increases in allocations for LARCs, and kind of related to that, declining public sector procurement in some short-term methods. Now, I think one of the things, as all of us know, the focus of the 2020 market report is actually 2019, which, I think after a year of so much turmoil seems almost kind of prehistoric. But I think in reality, we're going to come to look at 2019 as a critical threshold in the evolution of the public sector market for family planning supplies. Because unlike sort of consumption-based data that inform, for example, our commodity gap analyses, procurement is ultimately a political and a programmatic act. So, 2019 was in many respects the last so-called normal year before the storm. And I think as a benchmark, it will probably allow us in the years to come to see how, or maybe more kind of precisely how effectively the world responded. Will 2019 or perhaps 2020 be the critical reflection point? Will declining or stagnant public sector investment of the past 6 years continue? Will countries after the hiatus of 2020 start to refill their pipelines? Will we see the donor community slow down, maybe even reverse the declines in spending that we anticipated taking place before the crisis began? And I think really only time will tell. For us in the RHSC, this year marks the beginning of a new 4-year journey to 2025 that will see us focus our energies on leveraging the 3 drivers of what we call our strategic pillars: availability, choice, equity, and quality. And those drivers that we call the 3 M's: money, more of it; markets, particularly healthier markets; and the movement of supplies from the manufacturer to the last mile. So this year's family planning market assessment really represents a critical part of that journey. It, together with other assessments, aimed at the broader spectrum of reproductive health areas, including the costed gap analysis, will really help us understand better and operate more effectively within the global market for reproductive health supplies. So again, thanks everybody for joining us. And I'd like to turn over to Martyn.
Thanks very much indeed, John. Many thanks for inviting FP 2020 once again to the webinar. It's wonderful to be part of this webinar in what's shaping up to be a very important and significant week for SRHR, of course. Great to be talking about the market report the same week that FP 2020 launched our annual progress report, the Arc of Progress. Great to be talking in the week when we also launched our new partnership over the next 10 years, FP 2030, and great to be reconnecting with many people, as Marie Chantale and John have reflected, in a year which has really shown the great strength of our community in adversity, and the massive efforts that have been made to maintain procurement and supply chain and products reaching the clients at the last mile. Just great to be with you all. Appreciate the partnership with RHSC and CHAI in our collaboration on this report, our ability to review it as we were also putting together our own annual report. So when FP 2020 was launched in 2012, the partnership recognized the urgent need for better tracking and monitoring of resource and commodity flows in the sector. And an immense amount of work has been put together in partnership to ensure that this greater visibility has occurred over the last 8 years. And the market report continues to be a significant contribution to our collective understanding and visibility of what's happening in the public sector contraceptive market across the 69 FP 2020 countries, and gives really insightful data, actionable data for donors, ministries of health, implementers and others to really put into effect those big strategic shifts to expand access. We've come a long way since 2012, again, in the 69 FP 2020 countries, 60 million additional users of modern methods in that time. And obviously the public sector provision of contraceptives has played a very important part in that. Our ambition to 2030 is really rests upon and is really very much based around quality products at affordable prices, paid for through donor and domestic financing. We talk about responsiveness, system responsiveness to the rights and needs of individuals. And so our collective work together is ever more critical in that regard. We're going to have a bigger, more inclusive partnership. We won't just be a 69 lowest income country in the world partnership. So I look forward to talking about future market reports in an expanded set of countries, of course. Just really look forward to the summary that Mary Grace and colleagues will present to us now. And if there are questions around financing, I may be able to add in a couple of pieces of context drawn for our annual progress report that was released this week. So with that, great to be with you all, and handing back to Mary Grace, I think, next. Thank you.
Great. Thank you very much, Marie, Chantale, John, and Martyn, for kicking things off and for providing those opening remarks. I similarly wanted to reiterate a big thank you to RHSC for their continued partnership, and to all of the suppliers and key stakeholders who are key contributors to the report and who absolutely were so this year. So without further ado, we can dive into some of these key trends, and I'll walk through the slides that illustrate them from this year's market report. So as mentioned during the opening remarks, this is the 2020 Family Planning Market Report, and this covers a 5-year period of family planning procurement in the 69 FP 2020 countries in the public sector from 2015 to 2019. So we're excited to share those trends today. Just to kick things off, I know that the speakers touched on this, but I think it's helpful to provide a refresh of some of the context of the Global Markets Visibility Project, as the Family Planning Report is a key output of that initiative. So the Global Markets Visibility Project is a collaboration across suppliers and key stakeholders in the SRH space to utilize shipment data from suppliers to address information gaps and remedy those gaps in the reproductive health commodities market. To that end, we collaborate with 16 participating suppliers for the Family Planning Market Report as of this year's 2020 market report. You can see the suppliers shown up on this slide, and these suppliers represent a majority of the FP suppliers that are supported by donors. So a good and comprehensive list is represented in this year's market report. The report has been and continues to be a tool that's proven useful for decision-making in the FP space, for donors, for policymakers, for key stakeholders, given the comprehensive and reliable view it provides into public sector FP procurement. The first report was launched in 2015 by the Global Markets Visibility Project, and it's now in its 6th iteration. So we're excited to see it continue to evolve and to share the results that are on these slides. To provide a reminder just of the information available in the report, we've laid out the structure of the report on this slide. to illustrate the data that you can find within it and that we'll be walking through today. So the main body of the report is really the supplier shipment analysis. As mentioned, this relies heavily on the data collected from 16 participating suppliers in the report. So each year we collaborate with participating suppliers and collect procurement volumes from the period relevant to the report. So for this year, that was 2015 to 2019 in the public sector of the FP 2020 focus countries. Once we've collaborated with suppliers to collect that data, we aggregate that data, and that's important because it helps us protect and maintain the confidentiality of supplier data, which is critical to this initiative. We leverage this supplier data for all methods of modern contraception included in the report, with the exception of male condoms. Given that male condoms are a fragmented market, we leverage RHI data for that particular method. And for those who may not be aware, RHI is a public database that historically has been hosted by UNFPA, and it contains procurement data from large procurers and donors in over 140 countries. With that data, we have the foundation of the report. So that provides us with procurement volumes in the public sector in the FP 2020 countries. And those volumes can really be used as leverage for all of the market analysis that we then dive into. So we apply pricing and CYP, or couple years of protection, from sources including the UNFPA contraceptive price indicator and USAID's CYP factors. And with that data, we're able to extrapolate around the volumes, the market value, and the CYPs, which we show in the report. With all of that shipment analysis complete, the report then dives into donor spend analysis. And this is really a look and a deep dive into the spend on procurement of contraceptives from two of the largest institutional procurers in the space, USAID and UNFPA. Each year, we work with these two procurers, and we leverage two different sources of data to illustrate these donor trends. So for USAID, we use the overview of contraceptive and condom shipments reports for the relevant period of the report, 2015 to 2019 for this year, and that data source is publicly available. For UNFPA, we work directly with the Procurement Services branch to collect that data and illustrate it in the report. With this analysis complete, each year we engage in discussions with stakeholders in the SRH community. So we converse with suppliers, donors, and implementing partners, share the results and the trends that we're seeing in these analyses, and we do so to bring some context and some color to the trends that are really popping in this data and to try to understand better what the data is telling us. We did that this year as well. It was extremely useful, and we supplement, of course, this section with existing literature in the space. So you can see that the report happens in conversation with other pieces of analysis like RHSC's commodity gap analysis. And so that provides more color and richness to the discussion included in the report. There are also supplementary resources included in the report appendix. So if you look in the report, you can see that there's a deep dive into procurement volumes by country and by method in the report. So that provides more of a detailed view. We also explain more about the methodology for estimating the size of the FP 2020 public sector market. And finally, we include additional market visibility analyses in two markets, Bangladesh and India. With that background, we can now dive into some of the key trends that we see in this year's report. To frame these trends, it's helpful to understand what's in scope for this report and what it covers. So as mentioned, the countries included in this report are the 69 FP 2020 focus countries. Within those countries, we focus on the public sector within the report, and it's important to note that we define that as including, of course, MOH and government affiliated procurement, as well as procurement from institutional buyers like UNFPA, USAID, and SMOs. The methods of modern contraception that you can see listed on this slide are in scope for the report. That includes condoms, orals, injectables, implants, and IUDs. And just to provide some background, the report really does enhance visibility in the space. And we can see this when we look at the coverage across methods relative to RHI, which is the other publicly available data source that I mentioned on the previous slide. So we've taken a look at the volumes included across all methods, with the exception of male condoms, for which we leverage RHI. And we can see that across all of these methods listed in the slide, the cumulative total of volumes across these methods is higher, and in some cases substantially higher, in the family planning supplier shipment analyses than in other publicly available data sources like RHI. So we think this report is additive and that it really is providing a view of and capturing volumes that otherwise might not be available and visible in the view of the public sector market. So with that said, we can begin to dig into some of these trends that we see in this year's report. And the first trend that we'll explore is the market value of the FP 2020 public sector market. Just to provide a word about the orientation of the data that we're seeing on this slide, on the horizontal axis, you can see the years listed from 2015 to 2019, the main report period. And then on the vertical axis, we're tracking the market value in terms of US dollars. The first trend that really pops in looking at this graph is that the market value is largely stable from 2018 to 2019. So we see a stable trend from the 226 million in 2018 to the 223 million in 2019. Across the 5-year period, of course, there are different fluctuations in market value. So that 223 million figure is lower than the 5-year high seen in 2015 at 269 million, but it's also higher than the low seen in 2017 at 187 million. So again, largely stable relative to the previous year. We do see some interesting product trends within these year-to-year bars as well. So if you look at the 2018 and the 2019 bars side by side, you can see that there are product declines in 2 categories, IUDs, and those are in this blue category that you can see on the right, and injectables in this orange category. So those categories are declining, but the market value remains largely stable as it's offset by growth in other categories, including condoms, orals, and notably implants, where market value reached a 5-year high in 2019. With that view into market value, we'll move next into key trends that we see in market volumes. Looking at this slide, again, we can see a similar picture. And just a note about how this slide is laid out, you'll see that we've included male condoms in the data row underneath this graph. And we've done that just given the scale of those orders. So the 1.36 billion in 2019 is much larger than pure volumes for the other methods. So we've pulled that out of the graph to best show the data. Looking at the data in the graph though, we can see that procurement volumes again are largely constant from 2018 to 2019. So in 2018, we see volumes of 249 million units compared to 244 million units in 2019. When we look at the 5-year picture, this 244 million figure is lower than what we see in 2015 at 317 million, but is also up from the lows seen in 2016 and 2017. Again, there's some movement within the product trends, so we can see declines in the blue IUDs category, the orange injectables category, and that's offset by increases in other methods, including orals, female condoms. The next view that we'll show of the market here is concentrated on CYPs. And CYPs, as mentioned, are a couple years of protection. And just a word about how this is calculated, we take the volumes that are aggregated across different suppliers and the data sources that we use, and then we divide those shipment volumes by the corresponding CYP factor, so a couple years of protection factor for each method. And that allows us to extrapolate into how many CYPs are shipped out each year and are procured in the Family Planning 2020 public sector countries. So looking at this graph, it's immediately notable that whereas the value and the volume trends were largely stable, there is indeed a notable drop from 2018 to 2019. So we can see 121 million CYPs shipped in 2018, compared to 105 million CYPs shipped in 2019. The main driver behind this trend is circled in yellow on the slide. So if you look at the blue IUDs category, you can see that there's a 15 million decrease in CYPs shipped from that method. That begs the question, why is that decrease not reflected more in the other graphs? And that largely relates to the cost and the CYP factor associated with the IUD as a method. So from 2018 to 2019, there was a decrease in IUD volumes of 3 million units. That did not overly affect market value, as the IUD is comparatively low cost. However, because the IUD has a comparatively large CYP factor, that does indeed decrease the number of CYPs shipped that we can see in this graph. There is some movement across other methods from these year-to-year trends in addition to the IUDs. So we can see that injectables in this pale orange-pink color have decreased from 20 million units in 2018 to 17 million in 2019. Some of that movement is offset by increases in other categories like implants, where we do see an increase in CYPs shipped from 31 million to 33 million. So some movement in other product categories. However, the main decrease in CYPs shipped that we see is largely due to this IUD category. To continue this deep dive into CYPs shipped in the market, we've compiled a different view of this data. So just to provide some orientation to this graph, this shows a percent view of the percent of each method that contributes to the overall product mix in each year. So you can see that from 2015 to 2019 on the bottom of the graph, we've taken a view of if we stack up the mix of each method by 100% and 100% stacked bar, what is each method contributing to that 100% mix? We've also added in a data row on the top of the slide here, just as a reminder that the CYP shipped value is indeed different in each year. So we've included that data as a reminder. With this data ahead of us, the trend that immediately emerges is that LARCs, or long-acting reversible methods of contraception, which are comprised by IUDs and implants, really comprise 2/3 roughly of the method mix in each year. And that's opposed to short-acting methods of contraception like orals or condoms. This is notable because IUDs and implants do not comprise 2/3 of the market value or volumes, so they provide an outsized percent of CYPs shipped in these years relative to other market metrics tracking their presence in the market. That concludes the supplier shipment deep dive. The next pieces of data that we'll show here relate to the donor spend analysis completed in the report. So as mentioned in the report overview, each year we analyze donor spend from 2 large institutional procurers, UNFPA and USAID. And the data that we'll dive into first is from UNFPA, and we work with PSB, the Procurement Services Branch at UNFPA, to collect this data and then to analyze it. So the data that you can see on this slide is UNFPA's spend on the procurement of contraceptives in the FP 2020 countries. And it's worth noting that this is spend just on contraceptive procurement as opposed to other metrics like overall family planning spend. And what this data is telling us is that it's quite exciting to see, but the 2019 spend on contraceptive procurement reached 162 million. Which is a 5-year high when we look at this data on contraceptive procurement. We can see that the year-to-year growth from 2018 to 2019 is 9%, and the compound annual growth rate from 2015 to 2019 is 11%. So a continued upward trend from the UNFPA spend on contraceptive procurement. When we look at the other source of procurement and funding data, we can see that USAID has different data. So each year we analyze the USAID condoms and contraceptives reports, which are publicly available. And using those reports, we can track USAID's spend on the procurement of contraceptives in FP 2020 countries. It is worth noting that male and female condoms are excluded from this graph, and that's due to how those values have historically been tracked across different departments at USAID. So we've pulled them from this graph for the sake of consistency. So just please note that about the data. Looking at this data, we can see that in the 2019 fiscal year, the spend on contraceptive procurement was 38 million. That is down 24% from the 2018 spend on contraceptive procurement, which was 50 million. And relative to the 5-year high spend on contraceptive procurement in 2015, which was 73 million, we see a negative 15% compound annual growth rate. So with that funding data presented, the final piece that we'll illustrate here from the market report before we open for Q&A are the key trends that bubbled up in our consultation with stakeholders, which we conduct annually. So as mentioned, each year we have conversations with suppliers, donors, and implementing partners in the SRH space to bring context and color to the trends that bubble up in the analyses of these data. So this year we did the same, and when we had these conversations, there were some key trends that emerged. So first is that we see a mixed picture regarding the longer-term outlook for donor funding. Of course, UNFPA's 2019 spend on contraceptive procurement, as shown, reached a 5-year high. However, USAID spend on contraceptive procurement was close to its 5-year low in 2017. Viewed in light with other sources of data in the literature, like RHSC's contraceptive commodity gap analysis, we can see that absent increases in donor funding, if funding decreases or even remains stagnant, a funding gap is likely to continue widening relative to demand for contraceptives. It is worth noting as well, and this emerged in our conversations with stakeholders, that we see trends in this report that are particular to the nature of the procurement data that was collected. So as mentioned, the heart of this report is really the supplier shipment data and the procurement data that we work with suppliers to obtain and then analyze. Procurement data is unique in that procurement data has its own limitations. It's not consumption data, it's not demand data, and accordingly it takes into account restraints on procurement, such as funding availability and product availability. So we shouldn't look at the value of the market and say market value is flat, that must mean demand is flat. Instead, we should say procurement is flat, and there are a variety of factors that could affect that. In our conversations with stakeholders, it did continue to emerge, and folks underscored that meeting growing demand in the FP 2020 countries will likely require a mix of increased donor and/or domestic funding, an increase in the availability of quality assured contraceptives, and continued initiatives to promote the affordability of those quality assured contraceptives and SRH products. It's finally worth noting, as mentioned in the opening remarks, that the scope of this report's data is 2015 to 2019. And as we're all aware, the COVID-19 pandemic has been ongoing in this 2020 period, especially as we continue moving into 2021. So we expect looking forward that when we analyze the data from 2020 for the next year's market report, we will see an impact from COVID-19, given the obstacles that COVID-19 has presented to suppliers, procurers, health systems, and the users of contraception. Finally, before we open things up for Q&A, I did want to emphasize that if you have not yet read the report and are interested in doing so, it's available publicly online. And to any suppliers who do not currently participate in the report and are interested in doing so, please don't hesitate to contact me. You can find my email available on this slide. And again, this will be shared in the webinar recording that will become publicly available after we close the conversation today.